This presentation is the second in a series aimed at helping persons to live healthier, longer lives. This series is based on a book entitled Revolutionary Health Book, which is currently on sale on Amazon. Many persons accept illnesses as necessary aspects of living and growing older. Nevertheless, initial medical observations indicated that habitually taking meals which are too heated can result in illnesses. Hence, persons can become ill unnecessarily and can grow older faster than they should. As a result of these observations, studies were conducted. These studies investigated whether the temperatures and frequencies of meals ingested had any association with the occurrences of certain illnesses. Thousands of patients were studied during a period lasting about 24 years. No patient in this study was subjected to any experimental procedure. Information used in this study was obtained from the medical histories, physical examinations, and investigations of patients. Also, information used in this study was obtained from the studies of other researchers. Histories of patients included their daily patterns of ingesting 1. Room temperature meals from 20 degrees Celsius to 33.9 degrees Celsius. It should be noted that the upper and lower values of room temperature vary depending on the climatic region one is living in. 2. Warm meals from 34 degrees Celsius to 42 degrees Celsius. And 3. Very warm meals above 42 degrees Celsius. It was found that thermal or heat injury to the gastrointestinal tract can occur when warm and very warm meals are ingested. Other investigators have demonstrated that severe burns were sustained without discomfort at 47 degrees Celsius. The lowest surface temperature which caused the burns was 44 degrees Celsius. However, injury to the gastrointestinal tissue can also be caused by repeated exposure to lower temperatures. It was observed that, compared with patients who habitually ingested room temperature meals, patients who habitually ingested warm and very warm meals had significantly higher incidence of certain illnesses. Examples of many of these illnesses caused can be seen in Revolutionary Health Book. Ingestion of warm and very warm meals occur commonly, especially when the environment is either cool or cold. There were other reasons why some persons habitually ingested warm and very warm meals. Many of the patients said that they preferred their meals to be very warm because they did not feel comfortable taking either warm or room temperature meals. Other persons said that the meals did not taste good if they were not very warm. Why should thermal or heat injury to the gastrointestinal tract be associated with abnormal events in other systems of the body? It is established that the gastrointestinal tract contains various substances, including enzymes, neurotransmitters, and other substances which can affect cell function. These substances are released into the circulatory system as a result of thermal or heat injury to the gastrointestinal tract. The circulatory system then takes these substances to various parts of the body. Hence, these substances can affect other systems of the body. There was long-lasting relief or cure for most of the symptomatic patients who stopped habitually ingesting very warm meals and used the necessary treatment for their illnesses. These patients reported long-lasting relief from their symptoms. They also reported faster rates of cure of their illnesses when these illnesses are curable. One does not have to use thermometers to measure the temperatures of meals which are ingested. The simple guideline is to take meals which are either a little above room temperature or at room temperature. Once the meals reach about halfway between room temperature and hot, it has too much heat. There was analysis of cases of persons who reported no long-lasting relief from their illnesses after they stopped taking meals which were too heated and used the necessary treatment for their illnesses. The analysis resulted in the following conclusions. 1. The patient either intentionally or unintentionally contributed to taking meals which were too heated. 2. The main factor which contributed to causing the illness was not the frequent ingestion of meals which were too heated. 3. The illnesses had existed for so long that permanent structural damage had already occurred. Episode 3 would continue with discussion of strategies which would contribute to persons living longer, healthier lives.